Okay, well, I'm getting my blood pressure checked. We have Tanya and Kelly here from the State Department of Health.
Yes.
Just reminding everyone that you need to have it done. See, and I don't want to have a problem. Last time I did a story like that, it ended up being a big deal.
We don't want you to have high blood pressure.
High blood pressure wouldn't be as bad.
I'm here for moral support because
Okay.
Mary can't talk
I'm not
while this
supposed
is
to
getting
talk.
done
Right,
because
exactly.
we need to keep her blood pressure where it's supposed to be. Okay.
Yes.
But you should get it checked.
Yes.
How often? Every year or more often?
At least
ahead.
every year.
Every year.
At least
And
every
they
year.
usually will do that in your physical exams. Is that correct?
They would, and then you're trying to find out if if your blood pressure is at 120 over 80.
So is that the ideal?
That's the ideal.
120 over
120
80.
over 80. And the reason we don't want people to talk, I mean, there's some other things that happen, is because actually the measurement is mercury.
Okay.
And it increases. If you're talking, your reading can be higher.
So I know it's hard for you to not talk, because that's what you do for a living, but you can't talk for a minute. Okay.
For a minute.
Okay, so she's starting the process. It's going to squeeze her arm a little bit, and
Yes.
really, it's not scary to get your blood pressure taken.
No, it's not. You just have to make sure that they have the right cuff for you. You know, if you have a very small cuff, it's not going to work either.
Okay.
Make sure that your back is supported and that you have been at rest for 5 minutes. And of course, nobody can talk. As you can see, Kelly's not talking either, and Mary's not talking. Because it can actually increase, for example, talking, it increases your numbers, the top number. It increases it by 17 millimeters, and the bottom one by 13.
So what's a bad number to be at?
Anything that's over 120 over 80.
Okay.
There's a pre-hypertension, and then there's a
Do it again.
hypertension, which is like 140.
Well, and,
Okay.
and mine might be a little bit high. It's
you
usually not
uncross
that
your
high.
legs?
Uncross my legs.
Oh,
okay.
okay, so there's
Little
different
trick.
things.
So another thing to remember is to keep your
Okay.
feet flat on the floor.
Okay, and you
Also.
probably want to just kind of really relax and breathe
Sit back,
and
okay.
pretend like you're not even getting your blood pressure drawn, I'd imagine.
It's not that bad.
Okay, so
though.
what's the most important thing you want to get across? Because we're just about to wrap this up.
Well, make sure that you go. It doesn't matter if you're healthy, if you're a runner, or you eat very healthy. Still, you need to go make sure that you check your blood
Because
pressure.
it's easy to fix. You can make changes in your life if your blood pressure is too high.
Yeah, and the thing with high blood pressure is that it's a risk factor for heart disease and stroke.
Okay, great. Well, we're going to take a break, and we'll be right back. We'll probably let everyone know how you did.
Maybe,
And
if I pass.
yeah, if she passes. We'll be back after this.